What is the good of having a great heart if your brain isn't there? So we know that by age 85 in Sweden or this country, 50% of people have dementia. It's a hell of a reward for a lifetime of hard work. So it was Megan Leary and her team from the West Coast who gave us some great insight into this when, in 2001, reporting at the stroke meetings in Miami, she had looked at over 5,500 MRIs of the brains of Americans. And what they begin to see at age 50? These tiny little white spots. What are these little white spots? Little strokes. But you know, age 50, big brain. Tiny stroke. Not a problem. But now, you snap your fingers, you're 65. You've had 15 more years of the good old American diet. And now you sound yourself saying more often than before, sweetheart, where did I leave the car keys? You get that. Bingo, 10 more years, you're 65. You look at her, sweetheart, where did I leave the car? Bingo, you're 85. You look at her, are you my sweetheart? I can't reverse that. You don't suddenly wake up on your 85th birthday with dementia. You work hard in all those preceding decades to lay the foundation for that dementia. Here is a normal MRI. I counted 90. Can you imagine a message trying to go through all of that scar? Now, if you look on the left, what you notice is that right here, the brain is right up to the skull. Good, healthy, big brain. On the right, wait a minute, what's all this big gap here? Between the brain and the skull. That's atrophy. That's cerebral atrophy. You don't want cerebral atrophy. What do you do to prevent that? Exercise. Exercise. Whether you're going to walk 5 days a week, almost fast enough to break a sweat, or you can bike, or you can swim. But exercise will protect the hippocampus for your memory and the frontal lobe for executive thinking, two areas that can enlarge. Now here, what you're looking at on the upper left is the thigh muscle of a 40-year-old triathlete. On the upper right, the thigh muscle of a 75-year-old couch potato. Lower one, thigh muscle, 70-year-old triathlete. Exercise. Now here on the left, what you're looking at is a pulse volume. This was in a patient, one of our earliest group, crossing the Skyway. To my office, he had to stop 5 times to allow the blood to get back down through these narrow vessels in his thigh. But I was so focused on his heart, I totally forgot about his leg. 10 months later, in the office, he said, Dr. Esselstyn, you recall when I first started seeing you, I was stopping 5 times crossing the Skyway to your office. Yep. He said, you know, the last month it got to be 4 times, then 3, then 2, then 1. He said, you know, the pain is gone. I don't stop. Don, back you go to the vascular lab. Now what you see, bingo, on the right. What is this? It's double. It is double. So now there we were. Within 15 months of starting our study, we now had absolutely irrefutable, rock solid, scientific data that food and food alone could reverse cardiovascular disease. And you're going to say, well, wait a minute. What about the statin drugs? Well, wait a minute. This is 1986. We didn't have statin drugs. So I've given you 2 examples today. Dr. Crow, who refused statins, Don, We didn't have any then. And pretty impressive what you can do with whole food, plant-based nutrition. Now, that's another, and this happens to be a retired high school chemistry teacher, age 78. And in his retirement, he and his wife enjoyed entering the square dance competition. But it was always during the fast square dance that he was getting bilateral calf pain. So he saw these vascular surgeons, and he wasn't enamored of the big operation that was planned for him. You can see here the image of the disease in his vessels. And so he found us over the internet, and he came for counseling. He said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of my calf pain? So I looked at him with great wisdom in my face. I said, probably about 10 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, I know in Cleveland, Ohio, what it's like when you look at a mystery on television or a sporting event. I don't know what it's like where you folks are from, but in Cleveland, just before you hear the advertisement, you will hear the mellifluous tones of the announcer say something like, when the moment is right, will you be ready? Now, we all know that the penile artery is quite tiny, and we know that the coronary artery is quite a bit larger than the penile artery, and therefore, not infrequently, before somebody comes down with heart disease, they'll find that they're no longer able to raise the flag. However, all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I'll get a phone call. Dr. Esselstyn, yep. This is Mr. So-and-so. Yeah, sure enough. Yeah, I said, Dr. Esselstyn, I thought I ought to give you a call because recently something has come up. And I'm wondering if I don't owe you another check.